So one of the most common questions that the medical team and the case management counseling team here at the Coleman Institute gets asked after folks go through detox is about insomnia. It's extremely common for people who have completed both our opiate detox and our alcohol detox treatment process to experience insomnia, and that is common for all types of detox treatments, not just ours. And of course, insomnia is very uncomfortable, and if you're not getting good sleep, it affects all parts of your life. It affects your mood, your energy, your ability to focus, your ability to do things like take care of children or go to work. So understandably, people want to know why they have insomnia and how to make it better. Being that I am a counselor, I always talk to people about the behavioral aspects of managing insomnia. And we talk about sleep hygiene as the group of skills that can help people improve the quality of their sleep. And sleep hygiene is very basic, sort of common sense skills, but oftentimes when I talk to folks about it, there's usually one or two things in there that they haven't necessarily heard of before, or that they haven't thought of as being important to consider when they are trying to get good quality sleep. Most of us have heard that you should stay away from screens, things like your phone or your TV before you go to bed. The light in artificial screens is very stimulating to the optic nerve. It can make it difficult for your brain to realize that it is time to go to sleep and start the process of making the chemicals that ultimately put you to sleep. In general, we encourage folks to make sure that 30 minutes, 45 minutes before they're ready to go to bed, they turn off the television and don't look at their phone. That is an important part of sleep hygiene. Avoiding caffeine and sugary drinks as well is also very important. What a lot of people don't realize is that it's good to avoid caffeinated beverages like coffee and soda up to 6 hours before your bedtime. A lot of people think about just after dinner or just in the evening as the time when they should stop drinking soda or stop drinking coffee, but it actually does take a while for your body to process out the stimulant that is caffeine. So trying to limit your consumption of these beverages 6 hours before your bedtime is also very helpful. Having a consistent bedtime and a consistent waking up time is also really important. It helps get your body into a predictable rhythm, and the longer that you stick to that schedule, your brain will actually begin to automatically start producing sleep chemicals 15-20 minutes before it knows that you're going to bed. So having that consistent bedtime and that consistent wake up time is super important, and oftentimes that's one of the areas where folks seem to struggle. They're maybe going to bed really late on the weekends and sort of waking up whenever they feel like it. And while it may feel good to have a sleeping in day, or there may be fun things going on the weekend, spending time with friends or family, what have you, it confuses your brain. So as much as you can, sticking to a regular sleeping time and a regular wake up time is very helpful. We also like to recommend different apps that help people sort of meditate and wind down at the end of the day. YouTube videos as well. Certainly I know that sounds like it may go against my earlier advice to avoid screens, but in general, as long as you're not staring at the screen for a long period of time, scrolling on social media or watching a television show, it's okay to look at the screen long enough just to pull up a relaxing video. Some folks like white noise sort of videos so that they're not sleeping in silence. Ocean waves are also very popular. The Calm app has certainly made that pretty accessible. A lot of folks know about the Calm app, and it's one that a lot of our patients like and use when they're trying to get to sleep. There's also different types of sort of over-the-counter home remedies that people swear by. Warm milk is a popular one. There's also chamomile teas that people enjoy. Peppermint tea. Both chamomile and peppermint tea are naturally decaf, so you're not getting that stimulant effect, but it's also cozy, having a warm cup of tea, maybe with some honey in it. The same thing with a warm cup of milk. And then if nothing seems to work and people are just really, really struggling with insomnia, we always encourage them to touch base with our medical team here at the Coleman Institute. There are different options that our team can talk with our patients about. We really want folks to be getting good, restful sleep. Sleep is when your brain heals. So it is incredibly important. It's important all the time, but certainly very important during recovery. So we always want people to have the best experience possible after their detox. We know sometimes that can come with a little discomfort, but we are always here for our patients. We want to support them even after they finish up their detox, and this is one of the most common questions that we get asked. So we're very familiar with the complaint, and we're very comfortable helping people find a way to manage it.